Let's dive into a topic that many are curious about but might feel hesitant to discuss openly: erectile dysfunction, commonly known as ED. Can testosterone therapy help with erectile dysfunction, or ED? This is a question that has been on the minds of many men and their partners. Erectile dysfunction affects millions of men worldwide, and it's not just a physical issue. It can deeply impact psychological health and quality of life. The emotional toll can be significant, leading to stress, anxiety, and even depression. So it's crucial we talk about potential treatments and understand them thoroughly. Addressing ED is not just about improving sexual performance, it's about enhancing overall well-being and mental health. First, let's define what testosterone is. Testosterone is a hormone predominantly found in men, though women have it in smaller amounts. It plays a vital role in various bodily functions. It contributes to muscle mass, bone density, and importantly, sexual function. Testosterone is essential for maintaining libido, energy levels, and overall vitality. Now, on to the big question: does boosting testosterone help with ED? This is a complex issue that requires a nuanced understanding. The answer isn't a straightforward yes or no. Research shows that testosterone therapy erectile dysfunction as a result of low testosterone levels. This therapy can help restore normal function in some cases. This condition is known as hypogonadism, where the body doesn't produce enough testosterone. However, if a man's testosterone levels are within the normal range, increasing testosterone may not improve erectile dysfunction. It's important to understand that ED can have multiple causes. In fact, there are risks associated with unnecessarily high levels of testosterone, such as increased risk of heart disease and prostate health issues. Oversupplementation can lead to adverse effects. It's also important to note that ED can be caused by various other factors such as diabetes, cardiovascular disease, anxiety, or depression. These underlying conditions need to be addressed to effectively treat EDD. Therefore, it's crucial to have a comprehensive evaluation by a healthcare professional to determine the underlying cause before starting any treatment, including testosterone therapy. A thorough diagnosis can guide the most effective treatment plan. If testosterone levels are found to be low, the therapy typically involves daily gels, patches, or injections that aim to normalize hormone levels. These methods are designed to be convenient and effective. For many men, this can lead to an improvement in the symptoms of ED, but it's not a guarantee. Individual responses to therapy can vary widely. Each individual's response can vary. Some men may see significant improvements while others may not experience the same benefits. Apart from medical treatments, lifestyle changes can also play a significant role in improving erectile function. A holistic approach often yields the best results. This includes exercising regularly, maintaining a healthy diet, quitting smoking, and reducing alcohol intake. These changes can enhance overall health and improve ED symptoms. These are beneficial not only for ED, but for overall health. A healthy lifestyle supports cardiovascular health, which is closely linked to sexual function. In conclusion, while testosterone therapy might help men with ED related to low hormone levels, it's not a universal solution for all cases of erectile dysfunction. Each case is unique and requires a tailored approach. Always consult with a healthcare provider for a diagnosis and to discuss the best treatment options for your specific situation. A personalized treatment plan is essential for effective management. Thank you for joining me in this discussion. Your health is important, and taking steps to address issues like ED can lead to a better quality of life. Remember, health issues like ED are nothing to be ashamed of. Seeking help is a step towards better health and well-being. Open communication with healthcare providers is key. Stay informed and take care. Prioritize your health, and don't hesitate to seek professional advice when needed.
If you have watched until the end of this video and think you've learned anything new or anything of value, please don't forget to press the like button and subscribe to the channel to stay up to date with all the videos. Don't forget to press the bell icon as well. Stay safe, stay healthy. Thank you.